Good morning, it's Tony Polella speaking. I'm a musculoskeletal physiotherapist and I work from Morley Physiotherapy Centre. And today I'm just going to help discuss with you some of the reasons why women get back pain in pregnancy. What are some of the causes of that? And of course, how to understand ways of preventing and curing those problems as they occur. So in my experience over the last 35 years as a physiotherapist, I've met quite a few women in the clinic who've come in with back pain related to their pregnancy. And also my wife and I have had 6 children, so I've actually experienced day to day what it's like living with a pregnant woman. And I must admit, Anna did have some problems with her back in those pregnancies, and I did help her get over those. So maybe I can also help you understand what you can do too. So whether you are pregnant right now or you're planning to get pregnant, you should probably understand how back pain can affect you. And this is quite a common problem. With about 45 to 50% of all pregnancies associated with varying degrees of low back pain. So low back pain is quite a natural occurrence in pregnancy. Now obviously most of those problems are mild, but in about 10% of women, the pain can become severe and can interfere with the ability to work or carry out normal activities. And in those cases, those women are the ones that come in looking for treatment. So with pregnancy, there are 2 common types of back problems. One's associated with the lower back, which is in the small of your back, and the other one's more of a pelvic pain, which is also known as sacroiliac joint pain, which is in the buttock or glute area between the pelvis, between the hip and the spine. Most of the problems are more severe in the 3rd trimester, which is roughly from around about 30 weeks of gestation. And so that's about a 10, 11 week period between about 6 and 9 months of pregnancy. The sacroiliac area is one of the common areas that we look at in pregnant women, and that's the area we call the bony ring, which connects your hip to your spine. It's a very important functional unit of the body that is the core of your pelvic area that allows normal patterns of movement during walking. So often when those joints don't work and those ligaments don't work properly, it's in the walking and standing department that you get most of the pain. So what are some of the causes of natural back pain in pregnancy? I guess the most obvious one is in pregnancy, from the early stages, there are hormonal changes that are occurring in the body. And those hormonal changes cause the joint support structures or ligaments in the pelvis to loosen and relax. The hormone's known as relaxin, and its name describes what it does in the body. It actually causes the ligaments in your pelvis to start loosening so that when you deliver the baby, your ligaments can allow the pelvic ring to open up and allow the delivery. So that lack of joint support not only affects your pelvis, but affects every other joint in your body. So there is a possibility of joint strains in pregnancy, which wouldn't normally happen. A second cause of back pain in pregnancy is to do with the natural weight gain that occurs. And in some women, that weight gain can be quite large, up to 10 to 13 kilos, up to 25% of the body weight. And this increasing weight causes a lot of loading on the weight-bearing structures. And it usually causes a lot of leg cramping and tightness as well. The third area that is normally looked at is the spinal posture or alignment of the spine that changes. As the baby grows in the womb, there is an increase change of the centre of gravity of the body. The centre of gravity moves forwards as the baby pulls the spine towards the front. And this changes the lumbar curve. It increases the arch of the lower back. And that's called the lordosis. And it also can cause a change in the pelvic tilt, which tends to tilt down towards the floor. This in itself changes the alignment of the spine, the discs, and changes the tension on the ligaments and the tension on the muscles. Another area that we should discuss too is stress. I mean, there's a lot of emotional strains on women when they get pregnant. It's obviously a joyful time, but there's a lot of it can become an emotional roller coaster. It can become a physical roller coaster. So that can be one of the areas that affects the ability of the body to handle pain. and that's one of the stress hormones that are released, make us more open to receiving pain signals from the body. Postural loading or strains are quite easily brought on by too much sitting, standing for too long, or walking for long distances. As the body's changing shape, as the body's becoming more affected by hormone changes, if you sit, stand, or walk for too long, the back starts to ache. And often it's worse towards the end of the day. And with a bit of a heat pack or a rub, a light massage and a bit of a stretch, it usually eases away. But it's quite interesting how that is a very common factor. And the body at this time is also liable to get strains from bending, lifting and twisting movements, much as it can happen in other stages of life. So your ability to handle prolonged sitting, standing and walking, or lifting and twisting strains can be affected by the pregnancy. And if a person's got pre-existing low back pain or problems, poor flexibility or core strength, together with poor levels of fitness, that's another factor that can predispose women that are pregnant to having low back pain. So what are some of the things that we can encourage you to look at in your pregnancy? I mean, everyone knows the health benefits of exercise, and I think that things like heart disease, cardiovascular disease, getting blood sugars down, preventing diabetes, is obviously a very well-known medical fact now, but the physical effect and the mental effect of exercise is amazing in pregnancy. A lot of women think they have to avoid exercise and protect their baby that's growing inside them, but really your baby's well supported and well managed in your womb, and you can become an active person as long as your activities are not too extreme or too vigorous. Your body can handle a wide range of gentle, moderate activity during pregnancy. Also, this helps to boost energy levels, which is a very important thing as well, very important benefit, and relaxation. So the physical effect and mental effects of exercise are really important for you to consider. So what exercise should you consider? Well, first of all, for a cardiovascular or aerobic benefit, anything that involves low to medium intensity exercise is ideal, particularly throughout your pregnancy. Things like walking, cycling and swimming are really good exercises to consider. I mean, obviously walking activities can become a bit strained towards the end of second trimester. So, but in the early stages, walking and also water exercise, like walking in water and hydrotherapy is a very good exercise to do. And if these can be, maintained for 20 minutes to 40 minutes, 3 to 5 times a week, you're getting a very good general workout for your body. If you want more specific exercises that include stretching, routines and strengthening, a lot of women prefer yoga and Pilates because these are gentle and moderate and often allow the body to stretch gently, and they're done in a way that tends to strengthen also the core and pelvic areas of the body. So done with supervision and professional help, yoga, Pilates and stretching and strengthening exercises are well suited for you. If you can improve your posture, that's also a very important thing for you. I mean, in sitting, it's really important to choose your chair properly. Avoid sitting in low chairs, soft, low couches, and because that's the area that will give you the least amount of back support. So avoid slouching and avoid slumping, and try to get a chair with adequate back support that isn't too low. When we're standing, try to avoid slumping the shoulders forwards and arching the lower back. This is one of the areas that women tend to do when their baby's getting really large and it's dragging them forward. So just pull the belly button in and try tilting the pelvis back as if you're trying to flatten your back. Interestingly, pregnant women find a lot of difficulty laying in bed for long. You think that would give them some rest, but usually laying on their back is very uncomfortable. They're more comfortable laying on their sides with their knees slightly bent and a pillow between their knees. Often sleep is disturbed or interrupted when they move. They find it very difficult to roll from side to side. So that's one area that will be a challenge in the later months. But if we keep our spinal area strong and supported, that helps us get our posture sorted out during the night's sleep. If the walking is becoming a bit difficult, I would normally recommend a woman look at getting a pelvic support or a sacroiliac belt. These are easily available from physiotherapists, and they're not too expensive, and they're applied in the daytime when they're getting a bit tired. Because one of the things that you'll find is that you get a lot of fatigue, and the muscle fatigue is one of the things that really affects the posture and movement control of the body. So far we've discussed some of the factors that are involved in low back pain in pregnancy. We understand that it's a natural thing. We understand that there's a lot of stresses on the body and on the emotions as well as we're pregnant, and that we need to look after the way we sit, the way we stand, and the way we walk, particularly with the posture of the body as we're getting larger. So let's see if we can give you some encouragement now to get out and get moving. That's one of the important things about pregnancy, is not to stay in one position for too long. And if you can get some help from your physiotherapist, they can prescribe exercises for you. Many physiotherapists have got a fit ball exercise program for pregnant women that they can do at home. So a lot of the exercises can be home-based, they're very convenient. And keep the exercise going throughout the pregnancy, and don't do anything that's too extreme or too strenuous for you to handle. So I hope this information's given you some understanding of back pain and how to prevent it, how to understand it. And if you're not able to cope with things that are getting a bit unmanageable, I encourage you to ring your physiotherapist. I was always happy to help you understand how you can get this problem sorted out. I wish you all the very best. Thank you.